If you have ever sat in a hospital waiting room, you know the rhythm of the place. Names called, screens updated, files pulled up before you have finished sitting down. On a Friday afternoon, in May 2017, across England, all of that simply stopped, behind a red window demanding $300. By the end of that day, more than 19,000 appointments and operations have been canceled across the National Health Service. Not delayed, canceled. And here is the detail that should genuinely bother you. The flaw that made all of it possible had already been fixed. Microsoft shipped the patch on the 14th of March, 2017, 59 days. That is how long the fix sat there. Free, public, available to every machine on Earth, before the worm arrived and found hundreds of thousands that had never installed it. In the next half hour, I will show you exactly how those 59 days happened, and you will leave knowing precisely which of these mistakes you are making right now. Start with the weapon, because it did not begin life as criminal software. It began as a government tool built deliberately by people with a budget and a mandate. Inside the American National Security Agency, teams look for flaws in widely used software and build reliable ways to exploit them. That is not a scandal or a conspiracy theory. For a signals intelligence agency, that is the job description, written down. One of the tools that came out of that work was called Eternal Blue. It attacked a Windows component called SMB Server Message Block, which is the service that lets computers on a network share files and printers with each other. SMB is old, it is absolutely everywhere, and it is trusted by design. On a corporate or hospital network, it sits wide open between machines, because that openness is the entire reason it exists. Nobody wants to type a password to reach a shared drive. Eternal Blue exploited a flaw in how SMB handled certain specially crafted requests, and it gave the attacker the ability to run their own code on the target machine. Not code with the rights of a logged-in user. Code with the rights of the operating system itself. And it did that without a password, without a click, and without any user being involved at any point. That property has a name in this field, and that name is the reason this story is not like every other ransomware story you have heard. Think about how nearly all malware actually reaches people. It needs you. It needs you to open the attachment, run the installer, approve the warning box, plug in the drive. Almost every hour of security awareness training ever delivered rests on that single assumption. Eternal Blue did not need you at all. If a machine was reachable on the network and had not been patched, it was already lost. The user could have been at lunch. The user could have been on holiday for a month. Now wrap that capability in code that automatically copies itself onto every other machine it can reach, and you no longer have malware in the ordinary sense. You have a worm, a program whose spread requires no human decisions whatsoever. Worms are the oldest nightmare in this profession precisely because they remove the human bottleneck. Ordinary malware spreads at the speed of human carelessness. A worm spreads at the speed of the network, limited only by topology and bandwidth. And that difference is not a matter of degree. It is a difference in kind. Human-paced attacks give defenders hours or days to notice and respond. A worm can cross a continent between 2 sips of coffee. The industry had, in fairness, seen this before and then quietly forgotten it. Code Red in 2001. Slammer in 2003, which saturated networks so completely that cash machines and an airline's check-in systems fell over as collateral damage. Blaster the same year. Worms were not a theoretical category in 2017. They were history that everybody assumed had finished happening, which is worth naming plainly because it recurs constantly in this field. The attack that eventually lands is almost never the exotic one nobody imagined. It is the well-documented one that everybody had stopped worrying about, arriving on infrastructure that was built during the years when nobody was worrying. Now add the second ingredient, which came from an entirely different world. Ransomware. Software that encrypts the files on a machine and then sells the victim the key to get them back. By 2017, ransomware was already a mature criminal industry with support desks and payment portals, but it spread the boring way, malicious attachments, poisoned downloads, one victim at a time, one click at a time. Nobody had successfully welded ransomware onto a worm at global scale. And that is the entire invention of WannaCry. Not new cryptography, not a newly discovered flaw. Somebody took an old, well-understood criminal business model and bolted it onto a stolen, military-grade delivery system that needed no human help. Which brings us to the question that makes this episode uncomfortable. How did a tool built inside the NSA end up in the hands of whoever assembled WannaCry? In 2016, a group calling itself the Shadow Brokers appeared and began publishing material that looked unmistakably like genuine NSA exploitation tooling, not descriptions of it. The tooling itself, working with documentation. How they obtained it has never been publicly established. There are theories, some of them well argued, and some of them nonsense, and I am not going to manufacture an answer for you where the evidence does not support one. What is not in any doubt is what they released. In April 2017, the Shadow Brokers dumped a batch of exploits publicly, and Eternal Blue was among them. Consider what that actually means practically. A weapon developed at enormous expense, designed for careful, targeted use against selected systems by people operating under legal authority, was published on the open internet for anyone who could read it. And there is no recall, there is no expiry date, no revocation, no way to unpublish it. Once an exploit is public, it is public permanently, and every criminal group on the planet receives it at the same instant as every defender. That asymmetry is the thing to sit with. The defender has to fix millions of machines belonging to other people. The attacker has to find one machine that was missed. Both sides got the same document on the same day, and it reopens an argument that has never been settled. When a government finds a flaw in software that its own hospitals, banks, and citizens depend on, it faces a genuine choice. Keep the flaw quiet and useful for intelligence work, or report it and have it fixed for everyone, including every adversary. Intelligence agencies have processes for weighing exactly that decision, and reasonable people disagree about how well those processes work. What WannaCry demonstrated, concretely rather than theoretically, is that the calculation has a term in it that is very easy to underweight. The possibility that you do not get to keep the flaw quiet, because somebody takes it from you. Now, here is where the timeline gets genuinely uncomfortable, and where most retellings of this story get the order of events wrong in a way that matters. Microsoft had already released the fix. Security Bulletin MS-170110 shipped on the 14th of March, 2017, a full month before the exploit was dumped publicly. Read that again, because the sequence is the whole point. The patch came first, which tells you Microsoft knew about the underlying flaw before the public leak, and the reasonable inference, never officially detailed, is that somebody warned them it was coming. So by the time Eternal Blue went public in April, the defense had already existed for a month. Every affected Windows machine on Earth could have been made immune by an update that cost nothing and required no decision more complicated than allowing a restart. And on the 12th of May, when the worm finally launched, that patch had been available for 59 days. The overwhelming majority of vulnerable machines had simply never installed it. So the real question of this episode is not how the attackers got in. We know exactly how they got in technical detail, and it is not interesting. The question is, why 59 days of free, published immunity went unused across hundreds of thousands of machines? Hold on to that question, because we are going to answer it inside a hospital, which is where the answer is at once the most brutal and the least comfortable for anyone who wants a simple villain. Friday, the 12th of May, 2017. The first large public signals came out of Spain, where Telefónica, one of Europe's biggest telecommunications companies, began telling staff over the internal announcement system to shut their computers down immediately. And then it was everywhere, more or less at once. That phrase, "at once," is the thing to hold on to, because it is precisely what separates a worm from everything most people have ever experienced. There was no campaign, no wave of emails going out in batches, no sequence of victims that an analyst could plot and get ahead of. The malware found unpatched machines and used each one it found to find more, at machine speed, in every direction simultaneously. Within hours, it had reached more than 200,000 systems across more than 150 countries. There is no marketing department on Earth that could achieve that distribution in a day. And nobody had a map of it while it was happening. The counts you have just heard were assembled afterwards from sinkhole traffic and victim reports and vendor telemetry stitched together over weeks. On the day itself, the people responding were working from fragments, a colleague in another country, a screenshot on social media, a customer who had stopped answering the phone. That is the actual texture of a major incident. And it is nothing like the way these events get dramatized. There is no screen showing red dots spreading across a world map. There is a group of tired people trying to establish whether the thing they are seeing on their own network is the same thing they are reading about on somebody else's. What an individual victim actually saw was almost banal. Files stopped opening. Then a red window appeared. Your files have been encrypted. Send $300 in Bitcoin to this address and a countdown timer running down beside it. Pay late and the price doubles. Wait too long and the files are gone permanently. That is standard criminal psychology. Manufactured urgency, an achievable price, a visible clock, industrialized and translated into dozens of languages. And the demand was almost modest, which is one of the strangest details in the whole affair. $300 is not a corporate extortion figure. It is priced for one worried individual with one laptop and one folder of photographs. That is the first genuinely odd thing about WannaCry. The delivery mechanism was, in effect, worth millions. A state-built exploit chain, publicly leaked. The business model bolted onto it was worth pocket change. It is the equivalent of using a stolen military aircraft to deliver takeaway food. The mismatch between the capability and the ambition is so large that it tells you something about whoever launched it. They were not a sophisticated extortion operation that got lucky with a good exploit. They were somebody holding a good exploit who had not thought very hard about the money. Meanwhile, the organizations being hit had not been chosen in any meaningful sense. They were simply reachable. Renault, Deutsche Bahn, whose station departure boards were showing ransom notes, FedEx operations in Europe, a Russian mobile operator. Honda. No target list, no reconnaissance phase, no decision anywhere about who deserved this or who could withstand it. Just network topology and whether a given machine happened to have installed an update from March. That is a genuinely new category of risk, and it is worth naming clearly. You cannot become uninteresting to a worm. There is no profile you can adopt, no low profile you can keep. Reachable and unpatched is the entire selection criterion. And when a thing that does not choose its victims meets a system that cannot afford to stop for even an hour, you get the part of this story that the world actually remembers. Because among the machines that happened to be reachable on that Friday afternoon were the computers of the British National Health Service. To understand what happened next, you have to understand what a modern hospital actually is technically. Strip away the buildings and the people, and what remains is a network. Patient records, imaging, laboratory results, electronic prescribing, appointment booking, the scanners themselves, the systems that decide which patient goes where, all of it networked, and every part of it built on the assumption that the network will be there. When that assumption fails, a hospital does not degrade gracefully the way an office does. It falls back to paper. And paper cannot see the last 20 years of a patient's medical history or the drug interaction that would have been flagged automatically. The disruption ran across more than 80 hospital trusts and touched around 8% of GP practices in England. That is not a handful of unlucky sites. That is a significant fraction of a national health system. Appointments were canceled, operations were postponed. Some emergency departments diverted incoming patients elsewhere because a department that cannot see records or order tests cannot safely accept people through the door. And it is worth being precise about why a hospital diverts rather than simply carrying on with pen and paper. Modern clinical safety is built on automatic checks. The allergy flag, the interaction warning, the previous scan, the patient forgot to mention. Those checks live in the systems. Without them, a hospital is not merely slower. It is operating with the safety net that its own procedures assume is present quietly removed. So the decision to divert is not surrender. It is the correct clinical judgment made by people who understand exactly what they can no longer see, and it carries its own cost to every patient who now travels further to be treated. And that cost does not appear in any of the numbers I am about to give you. A canceled operation is counted. A longer ambulance journey is not. A diagnosis that arrives 2 weeks later than it should have is not. Every figure in this episode is a floor, not a total, and the people who published them said so. The official figure, published afterwards, is more than 19,000 appointments and operations canceled. And I want to be exact about what that number is and what it is not. It is a count of cancellations. It is not a body count, and it has never been one. No death has ever been verifiably attributed to WannaCry. You will hear people claim otherwise, confidently, usually to make a point about cyber warfare. Do not repeat it. The verified harm here is enormous without anybody inventing anything. The financial estimate came later from the Department of Health and Social Care in a progress update on cyber resilience in health and care. The figure was about £92 million. That number splits in a way that is worth sitting with for a moment, because the split is more instructive than the total. Around £20 million represents losses during the attack itself, the lost output of a health service that had partly stopped working. The other $72 million is what it cost afterwards. IT support, restoring data, rebuilding and resecuring systems that could no longer be trusted as they stood. So roughly 3/4 of the total cost of this attack was not the attack at all, it was the cleanup. And that ratio, in my experience, holds in nearly every serious incident I have ever looked at. Which is why the question people ask afterwards, how much would prevention have cost, is almost always answered wrongly. You are not comparing prevention against the damage, you are comparing it against the damage plus a recovery bill 3 times larger. And the department itself was careful to caveat those figures as broad estimates because no data was systematically collected at the time on the cost of recovering IT systems or on the true extent of patient disruption. When the people publishing a number tell you it is soft, believe them. Now the question everybody asks at this point, usually with a certain amount of contempt. Why was a national health service running machines that were missing a 2-month-old security patch? Here is the honest answer, and it is not incompetence. A hospital cannot simply reboot at will. Some machines are attached to medical devices certified as a complete unit, where altering the software can legally void the certification of the device. Some run software that the original vendor no longer supports on equipment that costs a fortune and works perfectly well. Some cannot be taken offline during a working day. And in a hospital, there is no such thing as a quiet hour to do it in. There is also a budget dimension that nobody enjoys discussing. Replacing a working piece of equipment because its embedded operating system is out of support is spending money on something that, from the outside, appears to be functioning perfectly. Inside a health system with waiting lists, that money has extremely visible alternative uses, and the person who spends it on invisible risk has to justify it. So patching in that environment is not an IT chore. It is a clinical risk decision made by people weighing a theoretical future attack against a real patient on a real list this afternoon. For 59 days, the theoretical risk kept losing that argument. Every single day, it lost rationally. And that is the shape of nearly every large failure worth studying. Not one catastrophic decision made by somebody foolish, but a long series of individually defensible decisions, each one correct in isolation, accumulating quietly into a state that no one person ever chose and no one person could see whole. And that is the answer to the question I asked you to hold. Not stupidity and not negligence. A rational process, optimized for the wrong risk, running exactly as it was designed to run. And then, on the same day it began, the spread stopped. Not because of a government, or a vendor, or an emergency response team, or anything that appears on an organizational chart. A malware researcher was pulling the worm apart while it was still actively running, which is normal work on a bad day, and found something odd sitting in the code. A domain name. A long, meaningless string of characters that nobody would ever type. The malware was trying to contact that domain, and when he checked, the domain was not registered to anybody at all. So, he did what analysts routinely do with unregistered domains found inside malware. He registered it himself for about $10 in order to watch what connected to it and map the scale of the infection from the traffic. What happened next was not the plan, and he has never claimed it was. The logic buried inside WannaCry was, try to reach this domain. If the connection succeeds, stop and exit immediately. If it fails, proceed to encrypt everything. The moment that domain resolved to a real server, every fresh infection anywhere in the world asked its question, received an answer for the first time, and shut itself down. It was a kill switch, almost certainly built in as a crude check for the automated analysis sandboxes that researchers use, artificial environments which obligingly answer every network request, so a reply can mean you are being watched rather than running on a real victim. Which means the single thing that stopped the worst of this was, in all probability, not a conscience or a safety catch installed by a cautious author. It was an anti-analysis trick that misfired. The most consequential piece of defensive infrastructure that Friday was a mistake in the attacker's own code, found by somebody who was not looking for it. Whatever the intent behind it, the effect was global and effectively instant. The most aggressive worm in a decade was halted by a $10 domain registration on the same afternoon it launched. And I want to be careful in how I tell this next part, because the person who did it is alive, and the internet has spent years turning him into a symbol rather than treating him as a person with an actual documented history. The verifiable facts are these. He found the domain in the code, he registered it, the spread stopped. That is his contribution to this story, and it is genuinely enormous, and nothing that follows takes it away. He was later arrested on charges entirely unconnected to WannaCry, relating to banking malware that he had been involved with years earlier before any of this. He pleaded guilty to those charges in April 2019. In July 2019, a federal judge in Milwaukee sentenced him to time served and 1 year of supervised release. No prison. The judge explicitly credited the direction his life had taken well before the charges were ever brought. Both of those things are true simultaneously, and the honest version of this story holds them together rather than picking whichever one makes the better headline. People are not required to be simple in order to be useful. And there is a systemic point buried in this that outlives everyone involved in it, and it should worry you more than the attack did. The thing that stopped a global attack on critical infrastructure across 150 countries was one curious individual, working through his Friday, with no authority, no mandate, and no plan. That is not a defense. That is luck, and luck is not a control you can rely on twice. So who did it, and what did they actually get out of it? Take the money first, because the money is the strangest part of the whole affair. Across the entire campaign, 200,000 machines, a national health service, major companies on 4 continents, the ransom wallets collected roughly 52 Bitcoin, about $140,000. In early August 2017, those wallets were emptied and the funds were moved onward. Where they ultimately ended up has never been publicly established, and I'm not going to guess for you. $140,000 against 92 million pounds of damage to the NHS alone, and vastly more worldwide. Judged as a robbery, this was a catastrophic failure by the people who launched it. And that failure tells you something important about the operation. The payment side was a mess. Victims who paid frequently could not be reliably decrypted afterwards because the machinery for matching payments to victims barely functioned. Which points away from professional extortion. Professionals decrypt reliably because their entire business depends on the next victim believing that paying works and towards something that was launched before it was finished. The Bitcoin arrangement points the same way. 3 fixed wallet addresses hard-coded into the malware and shared by every victim on Earth, which makes it impossible to tell who is paid and who is not. Ransomware operations that actually intend to collect generate a unique address per victim. This one did not, which suggests collecting was never really the design. On attribution, both the United States and the United Kingdom publicly blamed North Korea, pointing to the group commonly known as Lazarus. In September 2018, a United States criminal complaint was unsealed, charging a North Korean national, Park Jin-hyuk, in connection with WannaCry, the 2014 attack on Sony Pictures, and the Bangladesh bank heist. Further defendants were added in a 2021 indictment. Now the careful part, and I'm not going to blur it because this is exactly where documentaries get sloppy. Those are charges. Prosecutors allege them, He has never appeared in a United States court. He has not been convicted of anything, and North Korea denies involvement entirely. Government attribution in cyber is a judgment assembled from code reuse, infrastructure overlap, timing patterns, and intelligence that you and I will never be shown. It is frequently right. It is still not a verdict, and the distinction matters. What is beyond argument is what changed afterwards, and that is the real legacy of this story. WannaCry was the moment ransomware stopped being an IT department problem and became a national security one. Before it, cyber risk to hospitals was a slide in a presentation. After it, it was a cabinet-level briefing. Britain restructured how the health service handles cyber risk, with central standards and monitoring, rather than leaving each trust to manage alone. Governments across Europe began treating hospitals, power, and water as critical infrastructure in the operational sense rather than the rhetorical one. It also permanently changed what a board expects to be told. Before May 2017, the honest answer to "Are we exposed?" was usually a description of the security products in place. Afterwards, the question became a number. How many days behind are we? On how many machines? And which of them cannot be restarted? That is a far less comfortable conversation and a far more useful one. And every serious organization eventually absorbed the lesson that those 59 days taught. Patch latency is not a technical metric that belongs in an IT report. It is an exposure window, measured in days, and somebody out there is always counting them. The uncomfortable postscript is that Eternal Blue did not retire after May 2017. It kept appearing in other people's attacks for years afterwards, finding machines that still had not been patched, long after the entire world had watched what it could do. And that is the part I would ask you to carry out of this episode more than any technical detail. A patch existed. A global demonstration of what happens without it existed. Extensive news coverage in every language existed. And the exploit still kept working for years, because somewhere, a machine was quietly doing its job and nobody wanted to be the person who took it offline to restart it. So what do you take from this concretely? 4 things. And the first one is for you personally, today, on the device you are watching this on. 1. Turn on automatic updates and stop postponing the restart. WannaCry did not defeat a security product or outsmart anybody's firewall. It walked through a door that had stood unlocked for 59 days on machines whose owners kept clicking "Remind me later." The gap between patch available and patch installed is the single most exploited number in this entire field. 2. Your defenses almost certainly assume a human mistake somewhere in the chain. WannaCry required no click, no attachment, and no mistake at all. So ask this of anything you rely on. Does this still protect me if nobody does anything wrong? If the answer is no, that is not security. That is training, and training does not scale to machine speed. 3. Offline backups are the only real answer to ransomware, and almost nobody has one. A synced folder is not a backup. If the original is encrypted, the sync faithfully copies the encryption. You need a copy that is physically disconnected. Everybody who had one paid nothing, lost nothing, and had a merely irritating weekend. 4. When you hear that some organization was hit because it was careless, ask what their patching decision actually cost them on the day. In the NHS, it meant taking clinical systems down during a working day, with patients waiting. Understanding that difference is the entire distance between blaming people and fixing systems, and only one of those has ever prevented a second incident. The sentence I would keep from all of this is short. WannaCry was not a failure of knowledge. Every single thing needed to stop it existed, was public, and was free 59 days early. It was a failure of urgency. And urgency is the one control that no vendor on earth can sell you, which is precisely why it keeps being the thing that is missing. But here's what makes the next episode considerably worse. WannaCry was loud, clumsy, and broke itself for $140,000. The same group that American prosecutors named in this case is also alleged to have run an operation that was silent, patient, and technically immaculate, and came within a rounding error of stealing $1 billion from a central bank through the messaging system that moves the world's money between countries every day. Next episode, the Bangladesh bank heist. $81 million out the door through Swift, a printer that stopped working at exactly the right moment, and a single spelling mistake that saved the rest of it. If you want more of this, follow the channel. One episode every day and a different series for every day of the week. I am Niels. Thank you for giving me the last half hour. Patch your machines, and I will see you tomorrow in Dhaka.